Hi, I am Dr. Felice Gersh. Welcome to my Instagram live show. I have introduced myself a few times, but let me do a quick one. I am an integrative OBGYN doctor. I'm board certified in integrative medicine as well as in OBGYN. I have an office, which I'm speaking to you from, in Irvine, California, where I see patients every day, Monday through Friday, both in person and also I use telemedicine these days quite a lot. Today, I would like to discuss a very common problem, an issue so many women suffer from. It's menstrual cramps. Now, the official medical term is dysmenorrhea, but we all know of it as just those disabling cramps that so many women suffer from. Now, it's broken down into two categories: primary dysmenorrhea and secondary. Primary means that you have terrible cramps. Of course, it could be variable, but usually it's only the bad ones that get the attention. So you have bad cramps from the very beginning of puberty, once your period begins. Secondary dysmenorrhea means you've been fine for a while and then cramps start coming on. So primary dysmenorrhea is usually functional. In other words, there's not any actual structural or disease entity. A secondary is more commonly associated with a condition that is a pathology like endometriosis or uterine fibroids or adenomyosis. That's a condition where the lining glands from inside the uterus migrate into the muscle of the uterine wall and create this cramping effect. So it's really important for every woman who develops secondary dysmenorrhea to see her gynecologist to get evaluated. For primary dysmenorrhea in a young teen, so the typical age for getting a period these days is around 12, 13, and of course we have some that start as early as 10, but once the period is begun and right from the get-go, there are bad cramps, it's not necessary, unless they're totally disabling, to see a gynecologist. There are certain things that we can do. The first thing to know is that what is happening when you have a menstrual cramp? The uterus is actually contracting. In fact, they've put in pressure gauges inside the uterine cavity and have measured actual pressure changes. It turns out that women who experience more severe cramps actually have more severe cramping. The uterus is actually contracting. So think of it as a mild version of labor when women deliver a baby. The uterus is a muscle, the dominant tissue type. It has a glandular lining and it has a serosa on the surface, but it's predominantly a big bundle of muscle that has the capability of contracting. Now, why would the uterus contract during a labor? Well, obviously to get the baby out. But what about when you have a period? Why would you want the uterus to contract? It's to help expel the dead and dying uterine lining tissue along with the blood. So if you realize, which I know you do, but just as a reminder, that a period is a sloughing of the uterine lining so that it can start over again, so that a woman can prepare the uterine lining for a pregnancy. That's what it's all about. Now, and every month you get a new opportunity to get pregnant, but of course most of us in the reproductive years don't really want to get pregnant all the time. But the drive of nature is to allow women every month to have an opportunity to get pregnant. If it doesn't happen, the uterine lining sloughs out, that's the menstrual period, and starts over. And to help it slough out, the uterus contracts. But sometimes it contracts much too powerfully, creating that terrible pain. Now, when a woman has really bad menstrual cramps, it's a red flag that something is amiss. Nature did not plan for women to suffer every month. A little bit of cramps on the first day is normal, but excessive cramps, disabling cramps, it's a red flag. Now, it means something is going on. So, what is causing the cramps in the first place? When you have a menstrual period, the estrogen is at its lowest. And estrogen, when it's low, is more pro-inflammatory. When it's high, like right preceding ovulation, it's the most anti-inflammatory. So why would it be appropriate to have inflammation around the time of the period? Well, for the exact purpose of helping to get that lining out that now has to be replaced with a fresh lining to develop. So inside the uterus and in the pelvis, around the time of the period, you have an increase in these lipid signaling agents called prostaglandins. And these are pro-inflammatory prostaglandins, and they trigger this contraction issue. In fact, it's prostaglandins that trigger labor in women who are going to deliver a baby. It's the same basic process. It's just on a very tiny level when you're having your menstrual period. Now, sometimes there's too much of this prostaglandin, and that can create too much inflammation and too many severe cramps. That's why a lot of people take drugs like naproxen, Anaprox, and ibuprofen, the brand names like Advil, Motrin. They actually are non-steroidal anti-inflammatories. They actually block the production of prostaglandins. Now, I am not, if you know me, I'm not a big fan of long-term chronic use of these medications. But if you take it for the first day and you take just a little, a few doses, I'm not opposed to that because it can really help to really reduce the cramping. But what about other things? What about birth control pills? They're very commonly used. Well, birth control pills are not going to help the situation. If you have really bad cramps, once again, as I said, there's something amiss. Now, when you go on birth control pills, you're covering it up, like wallpapering up a wall that's full of mold or termites, and there's really an underlying issue. So, in functional medicine, which I practice along with integrative medicine, we like to look for root causes. So what are some of the root causes of cramps other than the disease states like endometriosis, uterine fibroids, adenomyosis? And I'll address them another time. Today we're going to talk about functional cramps, not due to pathology, just due to the function. So one really common reason why there's this overproduction of prostaglandins, too much inflammation, out of control cramps, is nutritional deficiencies, particularly magnesium. Magnesium is involved in over 700 reactions in the body, including muscle function. So most people, in fact, some have estimated over 80% of people have magnesium deficiency. So start by taking a magnesium supplement. If you tend to be constipated, that's actually a very sure sign that you're probably magnesium deficient. Start then with magnesium citrate. Take about 400 to 600 milligrams a day and see how things go. If you're not constipated, then I recommend instead taking magnesium glycinate in the same dose. Now, what about foods that have magnesium? Well, my personal favorites are walnuts and pumpkin seeds. They have lots of magnesium. So you don't just have to take pills, you can also do it with food. So add a handful of walnuts and pumpkin seeds into your daily diet. I love putting them in salads. I even like to eat them as like a dessert. I just love a couple of dates, big medjool dates and some walnuts. I know that's kind of Middle Eastern, love it. So give that a try as well. What else? Omega-3. Now, we are now just learning about the importance of fatty acids as signaling agents. And it turns out that these fatty acids that come from omega-6, omega-9, omega-3 are really critical to the inflammatory response and the resolution of inflammation. So some people are very good at starting inflammation, not so good at resolving and quieting it down. In order to resolve inflammation, which always starts when you're starting your period, that's an inflammatory event. The uterine lining is dead, it's dying, it's coming out, it's inflammatory at that point. So one of the things that you need is omega-3. From omega-3 come the specific pro-resolving mediators, SPMs. These are inflammation resolvers. They help promote healing and resolution of inflammation. Many people are deficient in omega-3. Eating sardines. Now, I grew up with sardines, so I actually like them. I put them in my salads. Give it a try. Don't be negative. Don't squinch up your nose on me. Also, anchovies. These are healthy small fish. They don't carry mercury, and you can eat them on a regular basis. 1 can of sardines has about 1 gram of omega-3, but most of us do need to take a supplement. So if you're having a lot of cramps, take a lot of omega-3. Try for a couple of months to take 3 to 4 grams a day of omega-3. Take 1 or 2 grams with some of your meals. I always recommend taking supplements that are nutrients with your food, because really that is where you're supposed to get them, from food. So like say for breakfast, lunch, and dinner, take 1 gram, like the one that I use from Pure Encapsulations, Omega-1. Each gel cap is 1 gram, so it's easy. But you can buy other brands. Just look at the label. Make sure it adds up to a total of omega-3, 3 to 4 grams a day. Try that for 2-3 months and see how the cramps resolve. It can be quite amazing. The other thing is to limit some of the pro-inflammatory omega-6s. That's what the inflammatory prostaglandins that are triggering the cramps are made from. And you have that imbalance. Now, omega-6s are very healthy and very important. They're also the foundation for making your endocannabinoids, which is one of the treatments I actually do recommend for some women with menstrual cramps. So it's when it gets oxidized. So many people include oxidized fats like oils and processed foods. Limit those. You can have omega-6 from very healthy nuts like pistachios and almonds. And by the way, walnuts are actually a good source of ALA. And that's one of the omega-3s that you don't convert it all to the others, EPA and DHA, but you will convert at least 5-10%, and it really helps. So that's one of the other bonuses of walnuts. So we have the omega-3 that you want to take 3 to 4 grams a day, and about 400 to 500 milligrams, up to 600 of magnesium. What else? Well, other antioxidants, because remember, it's an inflammatory process. We're trying to calm it down. Many of us have pro-inflammatory diets. So eating a diet that is high in anti-inflammatory vegetables and fruits. So I recommend trying to get in, I know this is a lot, but for people who have really bad cramps, you young women suffering with cramps, try incorporating 3 cups of vegetables with every meal and 1 cup of fruit. It's a goal. I know it's hard to actually do that, but make it as a goal. You can have a giant salad, and this is measuring raw. Remember, some foods, when you cook them, they do shrink. So try for 3 cups of vegetables, breakfast, lunch, dinner. Try as well to eat about 3 cups of varied and different fruits, different kinds of vegetables, different fruits. It's a goal. Get as close as you can. They found that to resolve an inflammatory state, you really need to have a lot more than what we used to think you need. So give that a try. In addition, you can take some supplements that are antioxidants, like vitamin E. But when you do, take it as mixed tocopherols and tocotrines. Don't just take DL-alpha tocopherol. We'll talk more about vitamin E, but be careful. You don't want a junky vitamin E. It actually can block the vitamin E receptors. So make sure you get a really high quality. And then vitamin C as well, of course. Now, I cannot leave out vitamin D. Vitamin D is a pro-hormone and very important for reducing cramps. A lot of people don't know that. Vitamin D is so in the news now with COVID as well. So you want to take at least 2,000 international units of vitamin D a day, and maybe get your vitamin D level measured. Go to your doctor and get that done and see where it's at. If it's really, really low, you may be benefited by a higher dose. So the other thing that can increase inflammation is not getting enough sunlight, not getting enough sleep, high levels of stress, sedentary lifestyle. Exercise can actually be dramatic in reducing menstrual cramps. So menstrual cramps are not supposed to be severe. They are appropriate to a minor degree, not a disabling degree. They are a warning sign that there's too much inflammation and overproduction of these inflammatory cytokines, and the solution isn't to get rid of your cycles. It's not to shut down your ovaries. It's not to take chemical endocrine disruptors, which is what birth control pills are, and similars. It's to fix the problem. If you have nutritional deficiencies, let's get on it. Let's get what you need into your body. Let's get the lifestyle going. Remember, the menstrual cycle is a vital sign of female health. If it's not working right, then there's something wrong. Let's get to the root problem and fix it.